When it comes to Medicare, most people either spend hours, weeks, even months researching Medicare, or they get sold a Medicare plan that they don't fully understand, although they thought they did initially, and it turns into an absolute nightmare that impacts which doctors they can see and also costs you a lot of money. So in this video, I'm going to show you exactly how to find the best Medicare plan for your situation to both save you time and have a really good Medicare plan. Medicare can be great when you do what's right and best for you. I'm Emily with the Medicare Coach, and I've helped over 100,000 people in all 50 states, including my parents, easily make their right Medicare decision. We are not an insurance company, we are not a broker, we're not the government, so you'll hear me say very different things on this video. This is why people come to the Medicare Coach to get really straightforward answers, to really be your advocate when it comes to Medicare. So let's hop into this and help you figure out how do you find your best Medicare plan. So there are 4 different, I'm going to call Medicare plans out there, and they have different decisions, which is why I want to talk about them separately. So the first kind of decision to make around your Medicare plan is around Medicare Part A and B. And the key here really is that most of you should join Medicare Part A and B at 65. Now, you can delay both Medicare A and B if you're covered by an active employer health insurance plan, which meets Medicare rules. I cover this in more detail in other videos, but the key is, one, you have to have an employer plan, either yours or a spouse's, that meets Medicare rules and does not require you to be on Medicare A or B. Requirement 2 is that the employer must have 20 employees or more. If your employer does not meet this requirement, you must join Medicare at 65. And the final one is the prescription drug coverage provided by the employer's health insurance. Is it creditable? Does it meet Medicare's rules? So again, most of you will join Medicare at 65, but we are seeing even more people delay Medicare after 65 because you or a spouse have employer health insurance plans that do meet Medicare rules and are ultimately cheaper than Medicare as well. So step number 1, do you join Medicare Part A or B or not? If you decide to enroll in Medicare Part A and B, you just join Medicare Part A and B. They are offered through the government. There's no companies behind these. You simply enroll in Medicare Part B through the government. So where it gets a little bit more tricky is the next 3 types of plans. So the other plans are Medicare Advantage, Medicare Part D drug plans, and Medicare Supplement plans. In order to have these plans, you usually have to have both Medicare Part A and B. So let's hop into these because they do have different decisions and will impact how you find your best Medicare plan. So when it comes to Medicare Advantage, we're going to look at a few different factors to determine which are our clients' best options. Now, this is an example of a client that we were helping with, so you're going to see a bit unique things about him. But I want to kind of walk you through how we think about how to find the best Medicare Advantage plan. Now, if you go back to my other videos, you know that choosing the program that fits you best, whether it be Advantage or sticking to original Medicare, is a very important decision. We can't always undo it in the future. And so this decision usually happens somewhat simultaneously, but we can't forget that the program that you pick has long-term implications and we can't always change it in the future. So when our clients want to see Medicare Advantage plan options, we do a couple things. Again, we want to know, what are your medications? This client has very standard medications, nothing crazy, very simple, no big deal here. We also know, who are your doctors? Which doctors do you want to see? And then we will look to see what Medicare plans do those doctors accept. Not all doctors take all Medicare plans, and we believe that in order for Medicare to work the best, you want to have it accepted by your doctor. Otherwise, Medicare will not cover any of those expenses. Okay. Now, once we kind of narrow down the medications and the doctors, we then dig into specific plans. Our first plan we look at is called Medicare HMO Blue Saver RX. Now, if you go back to this page, you will see that all of his doctors do take Blue Cross Blue Shield, which is great. So when we see that all doctors take one of the same plans, we will focus on that one company initially. So in his case, it's Blue Cross Blue Shield. Now, Aetna is a good next option as well, because Aetna is taken by his first doctor, Dr. Aaron, and Dr. Oliver as well, but not by Dr. Brian. So if the client hates the Blue Cross Blue Shield plan, Aetna will be our best option, our best next option to consider when it comes to Medicare Advantage plans. So Blue Cross Blue Shield. This plan is called Medicare HMO Blue, technically Blue Saver. It has a $0 monthly premium. It has a deductible of $0 for both health and medications. The max out-of-pocket is $9,200. And his provided medications will only cost $60 for the entire year at a place like CVS. So if we go through our process, medications, they're covered. Doctors, they're covered by this. Next one's costs. These costs are actually pretty reasonable. I think my one concern about this plan is the max out of pocket of $9,200. That can be a lot of money for people on a fixed income. And so as long as they're okay having the chance of paying that much money, I think it's a decent plan to consider. Again, on the right-hand side, we do have some of the copays. But again, if he's healthy, he'll have no copays. But if he sees doctors, he could have copays add up. And those copays could add up to, again, the $9,200 out of pocket for the calendar year. So we look at the costs. Now, maybe the client will say, well, that's great that this Blue Cross Blue Shield plan is relatively inexpensive on a premium basis. It covers medications relatively low. But what if his goal is really to have the lowest cost plan possible? And if that's the case, I would have him look at a plan called Aetna Medicare Eagle Giveback. Now, this plan has no prescription drug coverage. This is fine for him as he is a veteran and he has access to the VA pharmacy. And VA pharmacies do meet Medicare's requirements. But again, this is another option. Again, this plan has a $0 premium, a deductible of $0 for health and drugs. And it also has a lower out-of-pocket than the last plan had as well. The key difference for here is if you look at this extra benefit comment down below, it's a little small on this slide, but it says extra benefits $80 give back. So what that means is when a plan says give back, most of them will say if they have a give back, it'll have it in its name, but it's going to put $80 per month back towards his Medicare Part B premium. So if his ultimate goal is to have the lowest premium possible, this is a better option for him than the Blue Cross Blue Shield plan. Now, the trade-off here, though, is that not all of his doctors take this plan. So he has to decide, does he want to save $80 a month or does he want to have access to his doctors? All three of his doctors. And that's something that he has to decide what to do. Again, this plan does have copays as well, but again, you'll only pay those copays when you actually go use those services. Now, another option I showed him was called Aetna Medicare Signature PPO. Again, no drug coverage on here since he has the VA access. This premium $0, deductible $0, very similar out of pocket as the last Aetna plan. This one also has an $80 give back and has some dental and vision, right? So both of these plans are pretty similar. When these plans are so similar, there's not a huge cost difference either in this case. The biggest one is the drug deductible, but this client doesn't take medications through the Advantage plan, so it doesn't really impact him at all. So my point is this, is that when we look at Medicare Advantage, these are the things that we're considering when deciding which Medicare Advantage plan fits you best. In most areas, you have at least 10, sometimes even over 30 plans to pick from, and this will help us kind of narrow down which plan does fit you best. So again, medications, doctors, costs, and then extra perks, all right? So that's Advantage. Now, for our clients who go down the original Medicare route, you're going to need to pick out, in most cases at least, a Medicare Part D as well as a Medicare Supplement plan, okay? So Medicare Part D, because it only covers medications, there's a few things we want to ask our client about. One, where do you live? Because different zip codes, different counties have different plans. Number two, what are your medications? Number three, what's your pharmacy? And number four, are you using any coupons or have you had any special approvals when it comes to your medications that could impact our research, okay? This is going to be a little more simple, but this client had 3 medications, levothyroxine, rovastatin, and Tresiba. The first 2 are very generics, $0 cost medications in most cases. That's completely fine. But the trip up with this client was Tresiba. And this can happen with many different medications. So in this example, the client was currently on a plan called WellCare Value Script. And if this client kept the same plan into the new calendar year, they would pay $42.40 a month for this WellCare Value Script plan. The drug plan had an annual deductible of $615. And this client would pay for those 3 medications $9,162.24 at their preferred pharmacy, which is CVS. Now, that's a lot of money, okay? Now, if you look at the right-hand side of this slide, you will see underneath important coverage information are any of your drugs not covered by Medicare Part D. And in this case, Tresiba. Tresiba is not covered by this client's Part D drug plan in the new calendar year. So in order to have this medication covered, they will have to pay for it out of pocket, right? Medicare does have a $2,100 medication cap, at least for 2026. But if your drug is not covered on that plan formulary, the cap gives you absolutely no benefit. So this client would pay a lot of money if they stayed on their current WellCare value script plan. So as part of our research, we said, well, are there other options? Are there other plans that would cover all these medications at a much lower cost? And the answer is yes, Humana. Humana covers the plan and all the medications when it comes to this client. But here's the kicker. The monthly plan premium is $173.60 a month. That is a lot of money, right? That's a lot more than the $42 back here, okay? It's an extra $130 a month. But because this higher premium plan covers all the medications, the total cost for the entire calendar year for those same three medications is about $7,000 less for the entire calendar year. So yes, this client will pay higher in monthly premiums. But because the copays are so much lower, she will pay less on this higher premium plan. So in our case, we said you can stick with CVS, no problem there. But we do recommend you go to Humana Premier RX plan because it will save you medications it will save you money for your given medications. This client was happy to make the change for $7,000. They understood the trade-off of higher premiums, but lower costs. So again, when it comes to Part D drug plans, it is not just about the premiums. It is about the lowest total cost for your given medications. Now, if you take no medications, then fine, get the lowest premium plan, but you would be surprised at how many cost differences there are for even generic medications. So again, these details do impact you. So look at the medications, the pharmacy, where you live, and if you had extra coupons. Now, if this client had a coupon for Tresiba, or had something else that was going to cover Tresiba, maybe like a one-off approval from their existing Part D drug plan, this would change this conversation, right? There can be one-off approvals for certain medications through Part D drug plans, so that could impact our research. This client did not have any of those approvals. So she had to change Part D drug plans to get the lowest cost for the new calendar year, all right? So again, in this case, levothyroxine was cheap, rovastatin was cheap, Tresiba was even relatively cheap when it comes to these medications. So I'll walk through this quickly here, but when you look at these plans, you're going to have your medication name over here and then the retail costs, okay? And then you're going to have your costs after deductible. So $1,500, $1,499, and $750. This client was getting quarterly refills. This is a quarterly coupon number or quarterly copay number. If this client either hit their deductible or hit the $2,100 out of pocket, you would see more columns after this explaining those costs as well. But again, our clients, we want to show them like what can you expect to pay for every single medications. This also allows us to compare it more easily with GoodRx or other coupons to understand what makes the most sense for a client. Okay. With this client, she was best getting all of her medications on her Part D drug plan, but simply changing Part D drug plans. That's a big cost difference. So yeah. Okay, so that's Part D, how we think about those. The last one's Medicare Supplement, also called Medigap plans. So Medicare Supplement plans, again, are really important to get right the first time. And I'll talk about this shortly, but these are the hardest plans to get once you've been on Medicare for 6 months. So if you ever want to have one of these plans for the rest of your life, you probably want to get this plan right when you first join Medicare. Again, when you first join Medicare, you have a 6-month window where you are guaranteed, no matter what your pre-existing health conditions, to get one of these plans. But once you've been on Medicare for 6 months, you try to get a new plan or switch plans or companies, they're going to usually ask you for your pre-existing conditions, and the new company can deny you coverage if they don't want to cover you for any reason. So it is so important to get this plan right when you first join Medicare. Now, when it comes to Medigap plans, these plans are standardized by Medicare. So Medicare has a list of letters, and each letter covers different things, okay? So I cover this in more detail in other videos, but the key here is that there are different letters to pick from. Now, there are some unique states out there that do not have these letters. So if you live in Minnesota, Wisconsin, or Massachusetts, this is not available to you. These options are not available to you. You have different plans out there. But for the other 47 states, these are your letters to pick from. Again, the government standardizes the coverage, it standardizes the letters. Each company offers you these plans though, and they can determine one, the price, And 2, they can also determine if they add any extra perks to them. As I filmed this video, very few companies add any extra perks to their Medicare supplement plans, but there are a few out there in a couple states, okay? So when we're picking out Medicare supplement plans, we want to decide which letter fits you best. Now, as I mentioned, some states, 1, don't have all the same rules. And number 2, some states do have unique Medicare supplement plan rules where you can change more easily. So again, initially, all of you have a 6-month window to be guaranteed to change plans. After that 6 months, they can ask you for your health history when you try to change plans or companies. Now, this chart has states that have unique rules. The ones in the light gray are the most, and that's not true, the ones in the blue are the easiest to do, okay? So that blue, which is New York, Connecticut, and Vermont, have the most relaxed Medicare supplement plan rules. This means you can easily go between Medicare Advantage and Medicare Supplement at any point in time, no matter what your pre-existing conditions are. Now, so those 3 are unique. Every other state, even though it has a color on here, you might have a birthday rule or an anniversary rule, there's still some unique rules that don't give you as much flexibility as what you'd probably like to have. So for example, California has a birthday rule. California's birthday rule says you can change Medicare supplement plans to an equal or lesser plan around your birthday. So what does that mean? It means that you can go from, what it mainly means you can switch between different companies, okay? This plan, this rule will not give you the option to go from Advantage back to Medicare Supplement. In order to use these rules, you must have already initially joined a Medicare Supplement plan. You have to be in the game in order for these rules to work for you. So in California, yes, you could go to an equal or lesser plan. It's not going to give you the full flexibility that most people want to have, okay? But it will give you the option to switch between companies every single year on your birthday. So that's not a bad thing, right? So in California, our number 1 goal for our clients is to get you into the right letter, and we can always change companies every single year. Now, I say like Washington has some more wiggle room across different letters, but you have to have entered a Medicare supplement plan on a specific letter to even get this benefit as well. So just because your state is highlighted here does not mean you have all the wiggle room available. You don't. There are options to consider, but they do give you some extra wiggle room once you're on Medicare. We have to still get Medicare right when you first join Medicare. All right. Now, once we look at your state rules, look at your letters, we then figure out which company makes the most sense, right? There's so many companies out there. This is just a few of them. There's more. There's no rhyme or rhythm as to who's on here, who isn't. There's good companies on here. There's bad companies on here. But take it for what it is. But there are companies out there. My point is there are so many different companies offering you Medicare supplement plans, and you have to decide which company fits you best. And because in most states, you are not able to easily change Medicare companies, the first company that you pick will have lifetime implications. So please be thoughtful and thorough about that. Now, when it comes to our clients, and we go through this in more detail, we will sit down with them and say, okay, where do you live? What are your priorities, right? What does your health look like? Is your priority to have lowest premiums possible? Is your priority to have the lowest risk possible with higher premiums? Like overall, what's important to you? We ask, are you moving? Or do you live in multiple states? Things like that will impact the regions that we give our clients. Now, this is an example for a client that I was working with. And in her case, I showed her 3 options, a G, a high deductible G, and a plan N. So in here, I'm laying out all her costs, her Part A, her Part B with her high income penalty, her Part D plan, her Part D IRMA, and as well as her Plan G that I was showing, okay? I also show a household discount if it's applicable to her. And in her case, it wasn't initially applicable to her. Her husband's younger than her, but it could impact her once her husband joins Medicare, okay? So my point is this, we wanna go through the costs. So for this client, she was very healthy. So in her case, this high deductible G is her best option. She's better off paying a lower premium in terms of her total overall risk profile. She's okay paying a high out-of-pocket cost if she has to, which is $2,800. It's still lower than an Advantage plan, but she's okay paying a lower premium to have a higher risk, although again, this risk is much smaller than Advantage. Now, for other clients, probably her husband will probably be better off on a regular G, right? For him, he's probably better off paying a higher premium. He has health issues, higher premium for Plan G, and therefore have the lower total out-of-pocket cost for his case. We talk about tipping points too as to which tipping point makes the most sense for you, which one doesn't. But my point is there's a lot of numbers that go into this. So while I could sit here and our coaches could sit here and talk to you about how we think about supplement plans, the key for you is really understanding what's important to you. Everyone is different. Most couples will be on different Medicare plans because you have different health conditions, you have different priorities, you have different priorities, right? And so when we think about these plans, when we look at the numbers, there's a lot of qualitative things that go into this that really talk to our clients about it. I would say in very few cases does plan N make sense, but in some cases it can, depending on its premiums. But again, these are 3 good ones to at least look at and compare the costs when it comes to your plans. Again, all of our clients get this, sometimes multiple versions of this, to help you decide which company, which plan makes the most sense. Again, Cigna is not the best company for everyone. It happens to be the best company for this client in this case. Okay, we use a 7-factor supplement company scorecard to figure out which companies we recommend. Not all companies are equal. So we're looking at rate hikes, financial stability, customer service, overall performance in terms of how our clients have been happy with them. And so there are things that we look at to determine which company is better than others. Not all companies are good, and some of those name brand household insurance companies are not great options for Medicare supplement plans. So be thorough, be thoughtful. But again, numbers are important to look at when it comes to your Medicare supplement plans. So when we are talking about with our clients about plans to pick, whether it's Advantage, whether it's Part D or Medicare Supplement, there are different factors to consider to determine which one makes the most sense. Now, I'm going to have a video soon kind of walking you through in more detail as to how to find these numbers and how to figure out what makes the most sense. But conceptually, this is what we're looking at to help our clients understand how do you find the best Medicare plan. It is not a sales pitch, right? It's not like I sell for Humana, you should go to Humana, or I get a high commission on Plan G or Plan N, you should join that, or I get a high commission on Advantage, you should do that. That's not what we do here, right? We are a fee-based consultant helping you understand what are your options. And because of the long-term nature of how Medicare works, we want to get it right the first time so you have great coverage both now, but also 30 years from now. So make sure you follow along. I have some extra resources down below to make your life easy too when it comes to Medicare. So check those out and follow along for more inside tips to help you easily make your right Medicare decision.